I would encourage them to have a good relationship with a urine testing company, one that's able to do gas chromatography or liquid chromatography to really both quantify the doses of medication that are in the person's system, as well as to understand the metabolite pathway that some medications cause or can be subject to. The urine testing allows you to know exactly what substances is in the person's system, either positive or negative, and the metabolites that make sense from a clinical standpoint. It's important for the clinicians to have that in place to begin with, because the medium to high-risk patients are the ones that you're thinking are probably going to be doing some sort of illicit substance use or maybe obtaining medications that are prescribed for them. For example, if someone's on a time-release oxymorphone, that's all they're on. They're a medium to high-risk patient. You determine you're going to be on a time-release medication. You put them on a time-release oxymorphone product. That's all you're prescribing. Get a urine test result. If the urine test comes back with oxymorphone in it, that's what you expect. If it comes back with oxycodone and oxymorphone in it, that's not to be expected. The same can't be said if the person is on a short-acting medication. If they're on oxycodone, then the urine test will show oxycodone and usually oxymorphone. So it's up to the practitioner to know what the test should be showing so they can treat the patient fairly. You don't want to release a patient from your care for something that is a result of my own misunderstanding. I want to be sure I know what I'm looking for and apply that fairly to the patient. They may be in a medium to high-risk category, but they deserve dignity, they deserve respect as an individual, they deserve individualized care, and it's up to me to put processes in place and apply the processes that our practice has in place to treat the patient's pain aggressively, treat them fairly as an individual, and let me sleep at night.